Okay, welcome back everyone, and this is our last episode where we'll be discussing a very crucial topic, autism. For this final topic, we want to talk about which therapies can help with autism. What role does therapy play in the treatment of children with autism?
A therapist is actually known for delivering intervention services. It actually accommodates the teaching and the learning needs of a child. Okay, that's what interventions, and that's why we need the experts, the therapists, to come in hand together with the special educators. The therapy is not meant to be treated. Therapy is for intervention. Okay, so there's no treatment that involves in therapy. Okay, it's all about intervention. So their role is to provide more explicit directions which can help clarify the organizing and planning by who? For the parents as well as the teachers. For example, stammering the speech, which a teacher will not be able to know how to overcome the situation. So you need a speech therapist to build up the muscle tones of the articulations, for example. So that's where they come in, and then they will probably suggest to the parents, you need to also learn how to pick up probably some words or some sort of food, that can actually help to build up the muscle tones or something like that.
When is the best time to actually start therapy for children with autism?
Once the child's diagnosis has been accomplished, the earlier the better. Every parents need to know that a child that is having disabilities or a disorder, it is his or her right to know the condition of what he or she is going through. I think it is a norm in our society here. Try not to actually tell the child. Whereas in other countries like in Singapore, as early as in their preschool, they have lessons telling the child that you are suffering from, for example, autism. These are the things that you can do, but these are the things that you struggle with. But it's all right. We will work together, let you come up with the talents that you have, the strength that I was talking about.
How can occupational therapy help children with autism?
They will help to identify and address the sensory sensitivities. Occupational therapy is very beneficial to develop strategies to how children can manage the sensory input, such as creating the sensory diets. Through these occupational therapies, children are being taught on the self-regulation techniques. Macam mana nak kawal diri.
Same question, but how can speech therapy help children with autism?
So, for example, articulation. How to improve the clarity and the pronunciation of sounds. Language comprehension, which is a crucial problem with children with ASD, because they have difficulties with abstract concepts. So they need to understand the spoken language. And what is more important is how to follow directions. The other thing is pragmatics. So that means to understand and learn the social rule of language. Children with ASD, they don't understand figurative languages, they don't understand sarcasms, sometimes they don't even understand humor. So how can speech therapists help is to give them these pragmatic skills, understanding the social rules of language, when to laugh, when you laugh, how do you laugh? Increase the non-verbal communication. So how to enable ASD child to interpret facial expressions, body language.
How does play therapy help children with autism?
Play is one way of how child can imitate and then learn. Play therapy, it involves activities like role playing, storytelling, using toys to explore different emotions and situations. Play therapy can actually help children with autism to develop important life skills. It will also help them to feel more comfortable interacting with the people around them.
So basically, in conclusion, each therapy offers unique benefits that cater to different aspects of development. Thank you so much for sharing your professional point of view, because we are from a preschool, so we only understand to a certain point. With that, I would like to say thank you so much, Auntie Grace, and I hope to see you again in our next collaboration. And take care, parents. Assalamualaikum. Bye.